Hola. I'm Dr. Trevor. So today we are going to talk about some basic dental knowledge. So this dental training handbook was created with the help from Oral Health Africa Initiative, thanks to Dr. Timothy and Dr. Karim. So mainly based on uh, where there is no dentist and dental extraction technique for ENT and head and neck surgeons. So first of all, this is a warning. So this is not a proper training, and this dental training handbook is only for medical staff. So if you are not a medical staff, please don't use this training handbook. And this handbook is only used only when there's no dentist. So if there's a dentist, obviously you can go to the dentist so that you can get the proper treatment. So this is not a proper training, and please refer to the local guidelines. So first of all, we need to know the basic knowledge. We need to know about the teeth. So for adults, we have 32 teeth. So um, if you separate your teeth into 4 quadrants, so let's say it's left upper, left lower, right upper, and right lower. So each quadrant has 8 teeth. So let's say close to the midline, we'll label as 1, and then accordingly. And then, so in the middle, we have incisors. So we have central incisor and lateral incisor. So after the incisor, we have canine. And after canine, we have premolars. So first premolars and second premolars. And then after that, we have 3 molars. So first, second, and third molars. And because we have upper teeth, which is closer to our maxillary bone, and lower teeth, which is closer to our mandibular bone. So let's imagine a tooth is like a tree. So you can see the tree from the outside, but under the soil, under the ground, you can see there are a lot of roots. So it's the same thing. So a tooth, what you can see outside is what we call crown. But under the bone, actually there's root and root. So crown and root. And beside the tooth, there's gingiva connected to our tooth. And then here there's a gingival sulcus. There's a sulcus here. And then let's focus more. So we talk about the crown and the root, the gingiva, and the gingival sulcus. So let's focus on the crown. So for the crown, we can separate into enamel, dentine, coronar pulp, and reticular pulp, which is in the root. And our tooth is connected to the alveolar bone by periodontal ligament. So let's say if a tooth decay happens here in the enamel, there will be no pain. However, if the tooth decay has involved dentine, you will feel sensitive to the cold. Like when you drink a cold water, you will feel stressed and painful for a little bit. However, when the tooth decay has involved the coronar pulp, you will only feel pain when you bite. And when this phase happens, it's still reversible. So we don't have to remove the tooth. However, when it involves reticular pulp, you will feel pain all the time. So it will become irreversible. So when there's irreversible, we need to remove the tooth. And if the tooth decay hurts you enough to wake the patient at night, or it hurts when you touch it, it's called periodontitis. Periodontitis. So during this phase, you also need to remove the tooth. And then the second thing is need to know about the neighborhood. So our teeth is connected to the maxillary bone and mandibular bone. Maxillary bone and mandibular bones. So why do we need to know about this? It's because inside the maxillary bone, there's a hollow space, which is what we call sinus. Sinus. So there's inside the maxillary bone, there's maxillary sinus. And as you can see, the maxillary sinus is actually very close to our upper molar. It's very close to our upper molar. So you need to be careful so that the molar teeth will not protrude inside to the maxillary sinus. It's the same thing. So our teeth are also connected to mandibular bone. However, inside the mandibular bone, there's a passage, there's a canal. It's what we call inferior alveolar canal. Inferior alveolar canal. And inside this canal, there's a nerve, which is called inferior alveolar nerve. Inferior alveolar nerve. So as you can see here, our lower molar actually is very close to the inferior alveolar canal. So actually in this case, if you try to remove the third molar, the lower third molar, it's very risky because you might injure the inferior alveolar nerve. So we need to know about the complication. So the complication of removing a tooth is bleeding, infection, displacement into maxillary sinus, and inferior alveolar nerve injury. But how to avoid injuring the inferior alveolar nerve? So do not attempt to remove lower third molar unless you are a very experienced dentist with X-ray. So do not attempt to remove the lower third molar. If you happens to see a patient who might need to remove the lower third molar, please refer. Please refer. And we only remove a tooth only when necessary. And what do we mean by that? So it's when it hurts all the time, we say that it's irreversible pulpitis, or hurts enough to wake the patient at night is involve the periodontitis, or it eludes and it hurts when you touch it, it's periodontitis. So when it has a broken root or broken top with an exposed nerve, you also need to remove the tooth. But before that, we need to ask some questions. So, do you bleed a lot when your skin is cut? Do you have swollen feet and difficulty breathing? Do you have any allergies? Are you a diabetic patient? Are you pregnant? So the reason we ask is because you may bleed a lot when your tooth comes out, and you may have heart disease like heart failure, ischemic heart disease, if you have swollen feet and difficulty breathing. So you may be allergic to some medication we give, and your wound will take a little bit longer to heal if you are a diabetic patient. So sometimes some problem can be treated during pregnancy, but sometimes it's better to wait for pregnant women. So a person who bleeds a lot must know how to prevent bleeding afterwards. So maybe we need to place a suture to hold the gums tightly together. And a person with heart disease often take aspirin and or anticoagulant that do not allow the blood to clot normally. So maybe because of the medication he or she take, she will not stop bleeding easily. So we need to ask what medication the patient takes, and do not use more than 2 cartridges of local anesthetic in the patient with heart disease. So the epinephrine inside the anesthetic can be harmful for heart failure. So a person with allergies may be allergic to aspirin, penicillin, erythromycin, or other medication you often use. So we need to find out which medication has caused the problem and give a different type of medication, the one that will not cause a allergic reaction. So a diabetic wound may become infected. So we need to watch carefully the place where you took out tooth and give antibiotics. And during the last month of pregnancy, a woman may be too uncomfortable to have a tooth taken out. So if that's the case, you need to control the infection with a 5-day course of penicillin and then take out the tooth after the baby is born. So it's also better to wait if the patient has high blood pressure, because she may bleed too much when you take out the tooth. So here are some general principles. To be patient, be careful, and be considerate. So inject the local anesthetic slowly in the right space so that the tooth becomes numb, and you do not hurt the patient when you remove it. If the person says the tooth still hurts, it's probably true. Inject again. Use the correct instrument in the correct way. If you are careful, you can avoid breaking the tooth. When you take out a baby tooth, be extra careful not to hurt the new tooth growing under it. We need to explain everything to the patient, tell the person if something is going to hurt, even for a little bit. So when you take out the tooth, you can explain, for example, that you'll be feeling of pressure. So press on the person's arm to demonstrate what it will be feels like. When you finish taking out the tooth, explain what you have done and what the patients can do at home to help the mouth heal. Prepare instruments. So there are 4 basic instruments. We need a probe, we need an elevator, 2 forceps, one for the maxillary teeth, one for the lower mandibular teeth. So there's an injector you need, and then this is the cartridge which contains the local anesthetic, and this is the needle that will be put here, connect to the injector, and this is elevator, and then there are different type of forceps. But once you're certain which tooth must come out, decide which instrument you will need, and then lay them out ahead of time on a clean cloth. Before you touch your instruments, be sure your hands are clean. Wash with soap and water, and put on clean plastic or rubber gloves. So after, there are some steps of the dental extraction. So there are 8 steps to take up a tooth. First, explain what you are going to do. So always begin by talking to the patient. So explain why you must take out the tooth, and tell how many teeth you take out, and ask for their permission. Begin working only when the patient understands and agrees. After that, you can inject the local anesthetic. So do not inject local anesthetic into an area that's swollen. This can spread the infection. If the person has a heart problem, do not inject more than 2 cartridges in one visit. Also, it's best not to use anesthetic with epinephrine on patients with heart problem. Use lidocaine only or maybe Pivacaine only. So before you push the needle under the skin, be sure that its pointed end is facing in the correct direction. This pointed end is facing the tooth you want to remove, not away from the tooth. Before you inject the local anesthetic, wait a moment to see if any blood enters the syringe so that you will not inject the local anesthetic into the blood vessel. But where to inject? So let's imagine the nerve is like a tree. So it will have a lot of branches connect to the main trunk. So for upper teeth, so inject the local anesthesia near its roots. So the bone in the upper jaw is soft and spongy. Local anesthetic placed near the root of the upper tooth can go inside the bone and reach its nerve easily. So the same injection also makes the gums around that side of the tooth numb. So remember we need to uh, adjust its pointed end towards the tooth we want to remove. And then, so remember we say that the front teeth have one root, but for the back teeth, let's say for molar, we have more than one root. So for a tooth to become completely numb, the local anesthetic must touch the small nerve going to each of its roots. So first decide where to inject. Need to lift up the lip of the cheek or the cheek, and then see the lines forms when it joins and the lips or cheeks joins the gums. So the needle enters at the line where the lips or cheek meets the gum, or 1 centimeter above the crown. 1 centimeter above the crown. So push the needle in, aiming at the root of the tooth. And then after that, pull the needle away and move it over to the next root and inject again. So if you are taking out a tooth, also injects the gums on the inside. So we need to ask the patients to open the mouth widely and inject the remaining anesthesia directly behind the back tooth and wait 5 minutes for the tooth to become numb. So for maxillary bone, there are some different type of nerve block. However, the only thing you need to remember is the greater palatine nerve block. Greater palatine nerve block. This is used for the upper molar teeth. Upper molar teeth. So how do we inject it? So this is our palate, hard palate. So this is the middle of the palate. Imagine between the middle of the palate and the teeth, there's another line, and we need to inject beyond this line, but between the middle of the 7, which is the upper second molar. So imagine there's a line that cross over the middle of the second molar, and then with this, the other line, this is the area we want to inject for the greater palatine nerve block. So do not go beyond this point because you will injure the other nerve. but it's more difficult to inject the lower teeth. So the lower jawbone is thicker. So when you inject near the roots of a lower tooth, the anesthetic is not able to reach its nerve as easily. So to make a lower tooth completely numb, you must block the main nerve before it goes inside the jawbone. So this is the main nerve and this is the branches. If you are treating a back tooth, you must give a second injection for the nerve. So this is the nerve that goes towards the lower teeth. So the first one is the long buccal nerve, and then the second one is inferior alveolar nerve, and then the third one is the lingual nerve. You need to be careful not to injure all these nerves. So when you block the nerve, it affects all of the teeth as well as the gums on the side. So however, it takes practice to do this successfully. So first, I think it's better to feel for the place to be injected. So put your thumb beside the last molar tooth. Feel the jawbone as it turns you upward to the head. So actually there's a depression near the last molar. You can feel it with your thumb to feel the depression. And your needle needs to go from the first, second, third, and fourth, which is the first premolar. This is central incisor, lateral incisor, canine, and first premolar. We need to go between the third and the fourth, and then put the needles at the top, at the tip of the triangle of the depression. So press against the skin with the end of your thumb, and then the skin will V-shape. Your needle must go into the V, and then hold the syringe on the top of the tooth, and then aim the needle at the V. Push the needle in until it hits the jawbone, and then inject 1 ml of local anesthetic. And then remove the needle a little bit, and then give another 0.5 ml. After that, remove the needle totally, inject the needle just superior to the third molar tooth to block the long buccal nerve. So remember we said that the back teeth, like the molar teeth, they have more than one root. So you need to give another second injection beside the back teeth. So it's the same thing. So you need to inject where the cheek joins the gums and wait for 5 minutes for the tooth to become numb. After that, we need to test for local anesthetic. You can also ask whether he feels any numbness, or you can also use your probe to touch the gum and ask the patient whether he or she feels pain. Remember, we need to wait for 5 minutes for the anesthetic to start working. So for lower back tooth, the patient will feel local numbness, tongue numbness, lips and buccal numbness. So try not to hurt anyone. You can treat a bad tooth easier, faster, and without pain if you inject the local anesthetic slowly and carefully into the right place. So after that, we need to separate the gum for the tooth by using the probe. However, you can also use the elevator to do this because you will lose the tooth. So a loose tooth is less likely to break when you take it out. So before you take out a strong tooth, Always loosen it first with a straight elevator. And it's actually very important to hold a straight elevator properly. So you need to place your first fingers against the next tooth while you turn the handle. You need to control your elevator by putting your first fingers and hold it properly. So the blade goes between the bad tooth and the good one in front of it. And then we need to put the curved face. So this is the curved face. We need to put the curved face of the blade against the tooth we are trying to remove. To slide the blade down to the side of the tooth as far as possible under the gum. So every time you elevate, loosen tooth, after that you need to go down as far as possible under the gum. So turn the handle so that the blades move to the top of the bad tooth backward. So after that, after you have loosened the tooth, you can take out the tooth by using forceps. Remember, the tip of the forceps need to go as far as possible so that you will not break the tooth. So the beaks of the forceps must hold onto the root under the gum. The beaks of the forceps need to hold on to the root under the gum. If the tooth has one root, you can turn it. But if a tooth has 2 or 3 roots, you need to tip it back and forth, back and forth, back and forth. Tongue side, buccal side, tongue side, buccal side, and remove it slowly. And remember, take your time. So if you are hurry and squeeze your forceps too tightly, you can break a tooth. So removing a tooth is like pulling a post out of the ground. When you remove it back and forth a little bit more each time, it soon becomes loose enough to come out. So when the tooth comes up, look carefully at its roots to see if you have broken any part or left any roots behind. When possible, take out broken roots so that they do not cause infection later inside the bone. And to check, remember not to leave any root behind. After that, we need to stop the bleeding by squeezing the sides of the socket and then cover the socket with a cotton gauze and compress. Ask the patients to bite firmly for 30 minutes. So a child should bite firmly on the gauze for 2 hours. When you remove 2 or more teeth in a row, it's a good idea to join the gums with a suture. And then explain to the patients what to do at home to look after the wound. So the patient can take acetaminophen for pain, and he or she needs to take antibiotic as well. And do not rinse your mouth. It's important for the blood clot to stay inside the socket and not wash away. Do not drink hot liquids like tea or coffee because they will encourage bleeding. So try to drink more cold water. Continue to eat, but make sure the food is soft and easy to chew. Keep your mouth clean. So these are the take-home message. So as you can see, all the front teeth, they have only one root. The central and lateral incisor, the canine, the premolars, they only have one root. However, all of the molar right upper molar, right lower molar, left upper molar, and left lower molar. They have more than one root. So remember to check you have got all the roots. Make sure leave no roots behind. So this is the maxillary and mandibular teeth. This is the structure of a teeth, and the complication of removing a tooth is in bleeding, infection, displacement into maxillary sinus, and inferior oral nerve injury. And the 8 steps to take out a tooth. First, we need to explain what you're going to do: inject local anesthetic, test local anesthetic, separate the gum from the tooth, loosen the tooth, take out the tooth, stop the bleeding, and explain to the patients what to do at home to look after the wound. So this a warning again. So this dental training handbook is only for medical staff, only when there's no dentist. So if there's a dentist, please go and see a dentist. This is not proper training. Please refer to the local guidelines. Thank you.